The World Federation of Public Health Associations is pleased to present this video on the occasion of its 50th anniversary.
What I would like to see is public health professionals and organizations putting aside specific public health topics and working together, making advocacy together, with the final aim to set up strong, resilient and secure health system.
I think that public health will raise awareness of the crucial role to work with other sectors. It will enhance the public health capacity to cope with subjects such as environmental protection, to cope with law for a better protection of health as human rights, or with economics, since investments in health should be influenced by the interaction between health and economics.
Mon rêve, c'est d'avoir un peu partout, finalement, que la santé publique soit aussi dans la bouche de nos élus municipaux, de nos élus provinciaux, nationaux, que ce soit dans la bouche des entrepreneurs, que ce soit dans la bouche des professionnels de tout acabit, finalement. Donc, oui, une démocratisation de l'information, mais justement, je pense que c'est un superbe outil pour que tout le monde, justement, comprenne le rôle que peut avoir leurs actions en santé et que tout le monde se sente un peu plus, ait une plus grande capacité par rapport à la détermination de sa propre santé, mais aussi de la détermination de la santé de la communauté dans laquelle il figure.
I see public health integrating in all aspects of life, with governance on continual shaping of industries to meet an ever-growing health dynamic. This can and will be achieved as nations will profit more from human rather than resource-dependent output.
Despite conditions of precariousness and uncertainty that continue to surround us in the world we live in, there's an urgent need for critical thinkers in public health to draw on the way that African societies compose and invent themselves. Within these stories that speak to the everyday complexity of the world we live in lies the vision for the future of health for all Africans, written by Africans. Beyond the dogma and linear future projections of global economic powerhouses that perpetuate health inequalities.
Not only all around the world in different continents, but even in different disciplines. I think it should be really important for public health not to be focused just on medical, but also on economics, politics, ethics, history, anthropology, social studies, and have a broadest view possible.
I see the future of my field in isolating the genetic etiology through epidemiological methods, and also considering environmental risk factors for mental illness, including social determinants, and in doing so, synergizing the work of epidemiologists with the Human Genome Project.
In the next 25 years, I think that we're going to see a greater increase that we're already seeing with interactions between humans and our environment and greater burdens of disease coming from that. And I think one of the biggest challenges moving forward is looking globally at how we can turn the tide on the obesity epidemic, as it's a problem that is affecting both the developed and undeveloped world.
What would some of the greatest accomplishments in the future of public health be? The first would be protecting the vulnerable, and the second would be a focus on public mental health and incorporating it a little bit better into the health agenda. Protecting the vulnerable, I think with the rise in migration, we need to start looking at how public health focuses or works to the benefit of the health for refugees and migrants.
Public health needs confident, passionate, young, capable professionals to deal with the upcoming challenges. Therefore, pursuing higher degree in renowned universities around the globe can increase their capacity. It's not only about degree, but including gaining deeper knowledge, appreciate different culture, understanding complex situation, as well as taste the international experience.
In the next 25 years, I see public health as continuing to try and maintain its profile in a changing world. So as we become, more international with more travel and changes in our institutions, that we need to make sure that public health remains on the agenda for everyone and keeps up with the times.
Me gustaría ver que los gobiernos trabajen juntos para realmente alcanzar un mundo en donde todos tengan acceso a la salud pública, porque finalmente la salud pública es de todos.
Ultimate vision for public health is that each and every member of society changes their attitudes on health, that we start having honest conversations on what's lacking in our public health sector. We start having honest conversations on why we don't screen for mental health disorders, on why we have certain attitudes towards mental health disorders, on why we don't prioritize the health of impoverished communities. And I think if we start with those honest conversations, then we can move together as a society in not only addressing symptoms, but also addressing the underlying cause.
Okay, so what do I think about what public health needs to do in the next 3 to 5 years? I think it's really important for Public Health Australia to engage more researchers and young researchers from different fields, so more interdisciplinary research, but also have a specific contribution to global health. I think that's really something that we should be doing more and more.
Rising rapidly. While that of communicable disease is decreasing, moreover, some health-related issues is arising from the development of socio-economic. Hence, we should focus on developing public health in the next 25 years.
Where is public health going in the next 50 years? I am super excited to find out through the course of my career and that of my colleagues. It's a fascinating field filled with so many big, complicated challenges. Climate change, the re-emergence of infectious diseases, non-communicable diseases, and probably above anything else, equity, not just in health care, but in the social determinants of health and all the factors that impact health that are outside of the healthcare system. So I think we have a lot of challenges. Will we meet them? I'm not sure. But the peers that I meet and the young people that I meet inspire me every day and make me more confident that over the next 50 years, we're going to make the world a healthier place.
We have sufficient policies, goals, and a vision of public health care, such as the Alma Ata Declaration, primary health care, as well as universal health coverage and the Sustainable Development Goals. What is lacking for the future and what we will need in the future is the implementation and being solution-driven in terms of these visions.
The future of public health is, I see, a reduced burden of chronic diseases all over the world. And I believe that public health associations will actually help to reduce that burden. And there's a lot of experience and skills that are within the members of those associations that can actually help to improve the health of all the nations.
I think in the future, public health will be more closely with clinical medicine in promoting healthy environment, maximizing health outcome, reducing costs, and improving the efficiency and quality of the health system.
I think the future of public health is one of a very interdisciplinary practice where people come together, bring a variety of points of view, and where complex issues are addressed from a health lens across all sorts of policies. It should be used to address issues of equity, to address issues of well-being across the whole planet.
As we can see, the world is encountering a lot of problems, but on looking at the glass half full, there are a lot of enthusiastic activists and students who are trying to do something. And by the support of organizations and governments, public health is being well cared. So the way I see it, the future is bright.
Un très joyeux anniversaire à la Fédération mondiale des associations de santé publique.
Happy 50th Anniversary World Federation.
The 50th anniversary of the World Federation is great news in the international arena. Happy birthday and keep going with this wonderful work.
I would like to congratulate the World Federation of Public Health Association. Happy 50th anniversary.
Happy 50th anniversary, World Federation of Public Health Associations.
Happy birthday for the 50th anniversary.
I wish the World Federation of Public Health Association a wonderful 50th anniversary. Happy birthday!
最后，祝世界公卫生联盟的未来更美好。
Happy 50th anniversary, World Federation.
Happy 50th birthday, WFPHA. Joyeux anniversaire.